And so, Ada, can you please tell me a little bit about yourself and your current company?
Yeah, my name is Ada Palmadottir. I am pharmacist by trade, work as a business development director with Controlant. And I've been here 9.5 years already, providing services to our customers. We are in the business of real-time information for our customers that we provide with hardware, software, and services, combination of those three, where we give our customers insights into their supply chain in real time, as well as trend analysis, all kinds of analytics and dashboards, you name it.
Right. I can't think of a year that has been more important to the pharmaceutical supply chain than 2020 because of COVID.
Yes, that's definitely true. And it's always been about visibility. You know, we have this important vaccine to get distributed because we need to get out of this situation. You know,
right.
As a human beings, we need to be able to function again like a normal for our economy, for our health and everything. And so, of course, there's been a lot of focus, and it has been extremely valuable that the companies were able to develop vaccines so fast. Mm-hmm. But then it turned out that some of them were very difficult in distributing them due to the extreme low temperature needed for. Mm-hmm. And of course, what has helped a lot here is to have the visibility. First, to have the right boxes designed to keep the right temperature for long enough time for all the handover points, the storage during transportation, and the route to destination, so it can be administered to patients. But so important to get the visibility into what's happening at each time.
Right. I think we should note that you are in Iceland. That is where you are based. So how is that working with you focusing on other countries as well as like keeping in the know of your current one?
So we do have customers that are operating globally because we are servicing big pharma companies, and in a way it doesn't matter where you are, as long as you have internet connection, you have your mobile phone and your computer, you can operate from just about anywhere. Of course, we place our customer success people close to our customers, but like you mentioned at the beginning, this year has been so strange. We haven't been able to visit our customers, so everything is online anyway. So even more than before, it doesn't matter where you are in the world. You just have to have the right people.
That's good to hear. And so you have been on the pros to know list several times, so you should know best. But what are some attributes that qualifies someone as a pro to know?
To enter the industry, sorry.
Oh, what attributes do you think qualifies someone as a pro to know?
Sorry, yes. Well, I think, of course, you need to have a deep understanding of your industry. You have to understand what are the value drivers, what are the pain points of your customers. And of course, I would say you have to be interested in learning new things and applying your knowledge in practical manner for the industry as a whole, of course. So definitely, I think that's very, very important. Keep in mind also, keep up with the market trends, understand the customer's needs, as well as following, other markets, technology, how is it developing, and applying all this maybe from another industry. Maybe you can learn something from them and we can apply it in our own industry. And I also think it's, at least in my case, it's been extremely valuable being a pharmacist, understanding all the regulatory demands behind, and what's needed to be GXP certified and so on. This has been very important on my journey in this industry.
Right. And I can't even imagine having that knowledge now in like this current time too, and how beneficial that is.
Yeah, I mean, I think it's definitely something that I'm up to speed of what's needed. But
Mm-hmm.
of course, I have colleagues that are working in R&D, working in, legal, in logistics, in production, and it's already embedded in our DNA that we have to be compliant. So it doesn't take them long, of course, but it's even easier for pharmacists to understand, oh, we have a negative 80 product. Okay, I really understand what that implies in a way.
Right, right.
From the regulatory perspective, the quality and the, if you keep in mind what's important here is the patient receiving the right quality, right product at the right time.
Mm. And so you kind of touched on technology previously, but why do you think tech is becoming more important to the supply chain?
Because as I see it, it's the difference is, you could go around and not seeing anything, just, try to find your way out of your apartment in the street, walk to work, but you don't see anything.
Right.
Versus you have visibility of everything that's happening, not just in the planning process, your quality system and everything, but you also have a full overview of your supply chain. You know where the pain points are. You can more easily address the challenges. You can find out if your actions that your preventive actions are actually working, because you have full insight, you have real-time visibility into what you're doing. And this is not possible without technology. We need those, I sometimes say, the necessary evil. I was thinking if I had one here, the devices themselves, because it's not about hardware, but it's a necessary, it's a means to an end.
Right.
You place it, you use the technology of, measuring, communicating, analyzing, all for the benefit of, business excellence and patient safety in our case.
And it's just like with just like our phones, everything is in a phone now, and you can track your orders from like the very moment that they're placed. And it's just, I don't think our industry could survive without it.
No, same here. I'm totally with you there. It's so important.
And then what are some things that you think people should know about the supply chain?
So it's complex.
Yeah.
But you could say that, that's the same as with people. We are complex beings, but that's what makes it interesting, doesn't it? It's really something that's complex, but it doesn't mean, there are so many aspects to consider, but it doesn't mean that it's something that you can't master. But it just means, in my opinion, that we're always learning, we're always applying the latest knowledge, the latest technology to what we are doing in our search for the best solution, the save cost, reduce waste, improve performance, improve visibility. And what I really like everything what can have applied in front of it. It's not just about decisions, but applied or information, but applied knowledge and how you can use information to make better business decisions that in the end will benefit here in the pharma industry, the patient.
Right. And then what has all changed in the industry since you first started?
So, first thing, regulations have changed. When I started in this industry back in 2012, I think, or 11, we did not have the requirements that medicines would have to be monitored according to the label claim. That is what it says on the label, keep cold or do not freeze and so on.
Right.
Or that you had to transport at the label claim as well. So that was new back in 2013. So I know it's a long time ago, but that made all the pharma companies and all those involved in logistics for pharma, they had to be compliant to that, and not only tell that, yes, my truck is temperature controlled, but you had to prove it. You have to prove that temperature has been okay for the whole journey. Like, for instance, for this vaccine that we've been talking about, for extreme cold. It's not enough to say, hey, it was okay. You have to prove it. You have to have the temperature graph to actually prove that the product is safe to be used. So I think that is one of the things that has changed. So the demand from the regulatory standpoint, but on the other hand, technology has evolved so much, and it's been so much more applicable in like day-to-day operations. I mean, some things that were very expensive a few years back are now very easy. You know, you can have a SIM card in every device. I mean, you could not do it before because you did not have those roaming contracts or capabilities, and, you know, the battery lifetime of a device and the memory storage and so on to last for the whole duration of your route or your delivery. So, but a lot of things have changed also when, you know, if you move even further, you know, first we had all these like single use, we call it sometimes post-mortem lockers that you would place with the goods, you would ship it, at the end you would get the locker, plug it to a computer, and you would say, we had an excursion, temperature went out of bounds. Let me see, 2 weeks ago. I wonder where the product was, who was in custody of it, and so on. And that was what you had before. Now you have all this real-time information. You get the alerts in real time. You get notified immediately. You get the reports after the journey ends automatically. Nobody has to manually do anything. So I think, you know, and this in order to automate processes and also increase collaboration between stakeholders in the supply chain. So the owner of the goods, the forwarder, the warehouses, the airports, it has been made much easier to collaborate because we all have the same goal in mind, to keep the quality of the product at maximum.
Right.
So, and that's much easier when you know what's happening, where we have problems. You can really address it with the right stakeholders and not having to have conversations with them all just to find out, okay, where was that product 2 weeks ago? Who was in charge? Was it the ground handling agent at the airport? Was it the truck company, or, you know?
The regulations kind of really was enlightening because that 2013 doesn't seem that long ago. But it's crazy to see how much has changed, especially when you talk about collaboration too, because especially in 2020, that I feel like that is all we did. And the supply chain is just essentially one big collaborative project because you have to rely on other people to be successful. You can't just be the only person. Like the saying, there is no I in team, is super true when it comes to this.
Yeah, absolutely. And this, what we are also seeing, which is interesting, you know, talking about collaboration, is to see companies that would, before COVID, be competitors, actually working together. And this, you know, we have this noble act of, you know, we have to get the vaccines out there. We have to vaccinate all, you know, everybody in every country, or enough to get the herd immunity so all the economies can, you know, work for us again, you know. And this is amazing, that, and this is only possible through use of technology.
Right. And then how does being involved in industry organizations help impact your decisions at work?
Well, it really helps. We are part of organizations, and we also participate in conferences, for instance. Both, you know, we go and listen to what's the trend, what's the latest, what's the new, what's on the horizon. So we go to all kinds of conferences, both when it comes to technology itself, the supply chain, the pharma supply chain, which is an even narrower like subgroup within supply chain. And it's for sure gives so much being a part of a larger community. It helps to stay informed of industry changes, for instance, and challenges. And it also gives you a platform to meet all the stakeholders. You know, when you go to the conferences, you meet your competitors, your customers, your potential customers, your peers, and you are able to both learn and share knowledge that, you know, we can share knowledge that we have acquired and we want to share with the world with, you know, white papers, case studies, and so on. So it really helps us to, you know, connect with different individuals from different places that, you know, you normally don't come in contact with them without being a part of an organization like that.
Mm-hmm. And so what are some challenges that you may have experienced throughout your career? And if so, how did you overcome them?
Are you meaning like me as a person, or what in the supply chain?
Whatever you feel comfortable with sharing.
Yeah, I think, you know, because first thing about, you know, being a woman in supply chain, that's something that, you know, we are underrepresented. We are, I think, 38% of the workforce. So we could use more women. We could benefit from that, because I think we bring a perspective into the business that is equally important as the men do. Right. So I think maybe challenges to, you know, when entering an industry, especially when you're young, is to have faith in yourself and, you know, just go for it. So I would say maybe challenges for me at the beginning were typical what you could, you know, read about, that, you know, a woman goes out there and like thinks, the guys know it. Well, should I raise my voice? I think differently. I think, you know, but because you should trust your instincts, you should trust your knowledge and just go for it. That would be maybe on the personal level, just go for it and be brave. That would be my message, like on the personal level.
Yeah.
If you're in an industry that you have a passion for, and it's something you really want to work with, you should just go for it. That's my advice. As for the industry, for, you know, the challenges that we've met, of course, with the global outbreak of COVID-19, it exposed some weaknesses, of course, but opportunities as well in the supply chain. So, for example, I think some of the manufacturers figured out or found out that the raw material for their products were all coming from the same provider, let's say in China. And if China closes down, nobody's receiving the raw material. So we might have a stock out for that particular pharmaceutical product, if I'm focusing on pharma. So I think COVID-19 has helped us to maybe map out the inbound and outbound, the supplies and the product outbound shipments, to really, lower the risk of ending up in a situation where you can't get any raw material to continue with your, you know, producing your product, get it to market, and provide it to the consumer in case of consumer goods, or the patients for medicine. So I think that's probably, you know, what's on top of my mind right now, at least.
And then you gave some really good advice before, but going off of that, what is some other advice that you would give to those first starting out in the industry?
I think, you know, observe, you know, some people say that, you know, when you pick a job, you should really pick a boss. You should really go for, you know, work for people that you want to learn from, and that can, you know, give you that are maybe more like mentors rather than, or coaches rather than somebody just telling you what to do.
Right.
I think, you should, I think I would recommend to really look into both the company, the values of the company, to pick a place to work for where you feel that you can contribute as yourself. It might sound a little bit cheesy, but you be yourself, and because every day kind of counts, if you like, that you're able to participate and you are able to provide your share into something meaningful in the end. And it doesn't have to be such a huge thing. It's because if you look at the big picture, it all boils down to that, it's made of small things here and there. And if we don't do one small thing somewhere, nothing will ever happen. So it's all equally important in a way. So no matter how you might at first think, okay, this job, do I want to do it? If it gives you insights to the industry and opportunity to work with people that you want to learn from, I say the entry level doesn't matter that much. Don't be too focused on the entry level, as long as it's a good company and a good leadership that you would learn from.
I love that. I love all of that, because I think, especially people first coming out of college, they're often desperate for a job and they feel like they can't be picky, but sometimes the people make the job worth it. So having someone that can mentor you and help you grow can really help someone succeed. And reverse mentoring is huge too.
Yeah, and also it's about your attitude, if you're doing something and you don't think, okay, this is not the job that I'm gonna do for the rest of my life, but treat it with respect and do your best. It doesn't matter where you are at, but give it your best at any given time. Prepare for the future and do as well as you can in the role that you have, and look for opportunities to learn something that you might take with you then to the next place you know. So it's not necessarily, you don't have to start at a certain level. You can start wherever, and just you can make it into something by your attitude, the way you treat other people with respect and so on.
It's really the golden rule. Like, treat people how you want to be treated, and you'll get that back in return, hopefully.
Yeah. I agree. And it all sounds so simple, but sometimes we need to be reminded of even the most simple things. That's why we make like a task list in the morning, maybe. We know, and we all know what to do to live a healthy life. We have to sleep enough. We have to eat healthy and drink a lot of water and all that. But still, so many people fail to do that. And we have to remind ourselves, maybe every day, I'm going to work today, and it's maybe not the most fantastic job in the world, but this is where I am now, and I have to kind of do this well to get to the next level, something like that. Just an idea.
And so, Ada, we are running a little bit short on time. I mean, we're 6 hours apart. I'm sure you just want to get home now. But I only have one last question for you today. And what does it mean for you to be selected as one of SDCE's pros to know?
Well, I'm honored, I have to say. So I'm very thankful for that. I'm honored to be nominated by my team, and even more pleased to have been selected. So I'm really, feel that I'm kind of blessed. I'm very thankful for that. I am dedicated to the pharmaceutical supply chain. People need life-saving medicine, and we sometimes say that we are in the business of saving lives, because with our what I do every day is helping companies deliver products at the right quality. Because if you produce something, you have a product, pharmaceutical product, and you ship it out of the production site at the quality 100%. You can never add quality to it throughout the supply chain. You can only maintain it. And that's our business. That's to make sure that companies know if something is about to go wrong, so they can fix it and prevent the excursions, to reduce waste, to make sure there are no stockouts, there are never patients that cannot get their medicine because something happened in the supply chain, and prevent it, like not necessarily always high value products to reach the end, but in general products to reach the end. So, and technology, I think it is a fascinating mix, at least for me as a pharmacist coming in with my background and then having to learn all about the technology. I'm fascinated by it, and because it's evolving so fast. So,
right.
yeah.
Oh, well, that is really nice to hear. Congratulations, Ada. It was great being able to speak with you. Congratulations again.
Thank you. Nice speaking to you too. Have a good day.
Thanks.